Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hello and welcome to Research Perch. I'm Doug Nelson, the president of the Massage Therapy Foundation. Welcome back to part 2 of our discussion with our 2 guests from the massage therapy program at Nationwide Children's Hospital in Columbus, Ohio. Corrie Frey and Deborah Zerkle. Welcome back, Corrie and Deb.
Thank you.
So in our previous discussion, we talked about, the program and what you're doing. We'd like to drill down a little bit deeper into some of the logistics and especially what it's like to work in a hospital setting and how to explore that process as well. Since some people may not have done the first one, could we take just 1 minute to have you both introduce yourself?
Sure. I'm Corrie Frey. I've been working here at Nationwide for 19 years, doing massage therapy for 13.
Wonderful.
I'm Deborah Zerkle. I've been a massage therapist for 13 years, and I've been here at Children's for 7.
Wow. It's amazing what you're doing. And for everyone who is seeing this, if you didn't actually see the first segment, definitely do that to get a sense of the amazing work that these therapists are doing at Nationwide. I first met them at, so we actually funded a research study that they are working with in opioid use in the pediatric setting. And then we met at the IMTRAC, the International Massage Therapy Research Conference. And just in the few minutes we had looking at the poster that you guys did, I was just so blown away at the talk and the discussion, and that's where the idea for this perch came from. So I thank you so much for taking the time to do this. And we at the foundation are so proud of the work that you're doing, and we want to shine a light on the great work that is happening at Nationwide, and want to just let everybody know about that. So I have some slides that you've done, so I'm going to put those up on the screen if you would.
Okay. Well, we're so happy to share what we are doing, for sure.
What we'd like to do in this segment is just kind of go over the logistics of the process and how this all works. It's a remarkable program that you guys have with a rich history that that began in the early 2000s, I think 2001, 2003. So tell us a little bit about who governs how you practice and how that works.
Yes, so the Joint Commission is an accreditation body for hospitals, and they help support safety measures for patients. They're looking at the spread of information for patients and really how we're practicing and helping create change and care for our patients. And that's for the whole hospital. So we're working underneath the hospital umbrella. One thing I think is really important that I wanted to bring up about the Joint Commission is, I believe it was 2018, in their pain management protocols, they're asking hospitals to provide a non-pharmacological option for their patients to manage pain. So, and that can look like anything from music therapy to acupuncture to massage therapy. And I think that's really profound and something that we can build on for massage therapists that are in the hospital setting or want to be in the hospital setting.
And I remember reading about that. That was 2018, correct?
Yes.
I remember reading about that, but having that directive and executing that are 2 different things.
Very true.
And that's what's so remarkable about what you're doing, because you're an example of how that could be applied. And I think for a lot of hospitals, for a lot of institutions, it's like, well, that's a great idea. And how actually do we make that happen?
Yes, yeah. I will definitely talk about some processes and some ideas of how people can start working in a hospital setting, if that is your desire, in a few slides.
Great. Well, let's go to the next one and let's explore, like for instance, documentation. I mean, that's a big part of what happens. How does that work at Nationwide?
We get orders from the doctors or the nurse practitioners that they are wanting massage therapy for their patients. So we get what we call an eval, their evaluation sheet or order sheet, and then we are able to look in their chart and see what is happening and how we can best serve the patient. And when we go to the room, we, of course, introduce ourselves and do an evaluation on what's happening at that moment. You know, that might be in the chart in the morning that they've been vomiting in the morning, but now they're resting and they feel much better and they're ready for therapy. Or it could be the opposite. So we're really going in and seeing what the patient needs. And then once we actually work on the patient, we are in EPIC, which is our documentation program for the hospital. And we need to write what we offered for the patient, how the patient received massage, our timing, you know, anything pertinent that happened while we were there in the room. And then we go in and we set up education, that we educated the patient. If they're underage, that we educated the parents or legal guardians. And then we also will do our billing and our goals for that patient. So our goals can be from pain to anxiety to mobility. And I think I talk about that in the next slide. Also, we have to do documentation on when they leave the hospital, that our goals have been met.
What strikes me again is how fully integrated this is into the system. And that's really a dream come true.
Right. And it really gives us a good picture of what's going on when we're able to get into the chart and see something that might have happened 10 minutes ago or something that happened yesterday that might influence how we work on the patient.
And in the same vein, for the person who follows you, you know, not a massage therapist, but another healthcare provider, they also are learning from that, your experience with that patient as well.
Right.
And I'm sure that influences care in the same way.
Right.
Wow, it's amazing. So yes, let's talk a little bit about the workflow.
Yes, so we'll get the order, look through the chart, and then also something that is important, I know for a lot of us, is looking at maybe the psychosocial team notes, which is social work or psychology. If there's anything pertinent that we need to know, you know, with working with children, some of that might be legal guardians. Maybe dad is not, or mom is not supposed to be in the room. It's good for us to know that in case they walk in, because then we need to be able to relay to staff that, you know, that this situation is happening.
Yeah.
And then prioritizing, we really try to see our new consults within 24 hours. Because they might have something that is more acute and that we can help with, like say post-surgical pain. And then trying to figure out how many times do we need to see them in a week? Is it once? Is it 3 times? So we really try to see how can we best serve them during their stay. And their stay might be 3 to 5 days, like a spinal fusion. It might be months. So, and that can adjust and flow too, as needed.
Got it. All right. And building a care plan?
Yeah, so I feel like this is really something that is nice for us, is that we do get to have ownership of that, of what we feel is going to be beneficial for the patient. We get the order from the doctor or the nurse practitioner or resident, but then we're able to say, okay, we really need to focus on pain control or anxiety or maybe functional deficit or mobility and also motility for the gut. But again, that can ebb and flow. If they are a post-surgical patient and they're having a lot of issues with pain, maybe in the first couple days, but then that resolves and it's more about, okay, now they're up and moving with physical therapy. Maybe our goal is changing to functional deficit and we're trying to help them get up and move.
And And, frequency and dosage are always an aspect of the work. So tell me a little bit about that process and how you define it.
I think this can definitely be a little fluid. The majority of our patients, I feel, and it might be a little different depending on the unit that you're on, might be 2 to 3 times a week. There might be patients that benefit more from 4 times a week. And honestly, every day is different. We might have them set up for 3 to 4 times a week, but really that week with procedures or how they're feeling, we might see them once or twice. And that is okay, because we want to work within how they're feeling and what's going on.
The nice thing too is if there are days where we weren't necessarily planning on seeing a patient that day, we have vocers, which means that we have nurses that can contact us directly, and it just like pops on and says, room so-and-so is in a lot of pain right now. Can someone come see them to help? And so, we are really flexible. It's one thing in acute care, you have to be very flexible because there's no real set schedules, because you can have an idea of what you're going to do for the day and then it completely changes. So it's nice that nurses and staff can get a hold of us right away to say, this patient needs you, can you come and help?
And, with that kind of fluidity, it requires a great integration with the staff. And everybody has to come from that mindset. So the fact that you can pull that off is really impressive.
Yeah, I think when I train a student or a new hire, one of the things that I know I really stress is flexibility. Because going into a room with, okay, I know what's going to happen and this is how the session's going to look, is not necessarily the case. So you never know what's going to happen. Transport might show up to take them to a procedure. They might start getting sick, or sometimes I've had a 6 or 7-year-old say, okay, I'm done.
Right.
Then we're done,
Yeah.
And by the same token, for example, I had a patient yesterday that I was like, all right, I'm just gonna go see them for 15 minutes and get my day going. And then I ended up staying there for an hour because we were doing myofascial release, and this patient was responding so well that I was like, I can't just walk away from this. And so it was an incredible session, and the parents saw the benefit. And so, by the same thing, you go in thinking this is what's going to happen, and it was completely different.
Yeah. Again, as a clinic owner and, somebody who's been in, the kind of the private arena, just that kind of flexibility, to build that into the system, to structure it, to allow for that is no small feat. That is just really amazing. And the beneficiary in the end is definitely the patient.
Yeah, definitely.
Gosh, that's impressive. All right, talk to us about the educational aspect.
I think it's really important that when we go into a room that we really explain what we're going to be doing, because they don't know us, and we want our patients, especially our younger patients, to feel comfortable. One thing that I like to say when I go into a room with a new patient is saying, I'll explain why I'm there and how I hope to help and what I'm going to be working on. If they are able to understand, what I'm working on, I tell them specifically where I'm going to work. And something that I say at the end is, this is a nice therapy for you. If I do something that you don't like, it hurts or it makes you uncomfortable, you tell me and I stop. It gives them a little bit of power to be able to say no, which I think is really important. We are an optional therapy, and it empowers them to be able to say no.
May I just jump in for one thing about that, Deborah? In the field of pain, one of the really important things about pain is the loss of control, of agency, and so much of pain feels like you are just totally out of control, and so that you give the person that choice is a very, very powerful concept for them.
Well, and here in the hospital, in order for them to possibly get better, unfortunately, they might have to have IVs, and they might have to have things that they that might seem scary or that might hurt, but we are able to build that trust where they can say no.
Yeah.
No.
Wow.
It's really important.
That is a powerful thing. Just an addendum to the whole experience where, many things are out of their control.
Right.
It's something that actually is in that sphere of they get to actually drive the bus. And
Right.
That's a wonderful thing.
And if they're not verbal, some of the nonverbal cues that we might look for is, when they're on the monitor, is what's their heart rate doing? What's their oxygen doing? If their heart rate is picking up, then we need to either back off, or something that we're doing might not feel good. So we need to be aware of that as well.
Wow.
Something I want to go back to, like when we were talking about giving them the empowerment to say no, something that's very valuable is I learned early on not to just give up on them if it's a new consult and they say no the first 2 times.
Sure.
I've had kids in multiple instances who have been on my oncology unit who said no the entire first admission that they were here. However, I kept going back, kind of giving them that familiar face, maybe sometimes doing like engaging in maybe like a 5 or 10 minute activity just to start building that trust. And sometimes those are the patients who down the road are the ones who love massage more than anybody. But because early on we don't push it, we give them that empowerment to say no, because at that point all this stuff has happened to them that they don't understand.
Sure.
And there is incredible value in not giving up on them and just giving it time to build rapport.
And the other thing about that is it's not really, when you say no to something that you don't know what you're saying no to, it's not really a no, right?
Right.
You can only say no to something that you know what that experience is. Like, no, I don't like whatever. It's because you must have experienced that. If you haven't experienced it, you don't really know what you're saying no to.
Very true.
So your own patience with that and keeping that door open is a wonderful way to handle that.
And there are some patients who are really not sure, or they might be a little bit on the fence, and they're not sure how it's going to feel or if it's going to hurt.
Yeah.
Just bringing up the last point there is teaching the family. So maybe they're saying no to us, but they'll allow mom to massage their back. Or what I have done sometimes with some patients is, well, how about I teach mom? I'll show her on this leg or this foot, and she does it on the other foot. So they're getting to experience what my touch feels like. Mom or dad is there, and so they feel like it's a safer environment. And again, it might still be a no to me later, but I'm also teaching the parent. I've also done massage on teddy bear, stuffed animals, dolls, so that they can see what that might look like. But it's nice to be able to also educate the family.
Yeah. And again,
especially for homegoing.
And again, now the parents feel like they have some active role in this process. That's got to be something.
I will say it's pretty incredible. Years ago when I worked in the cardiac ICU, and a lot of these little kiddos are on all kinds of machines and they can't be held by the parent, and the parents are just kind of at a loss. Like, how do I comfort my kid? And by being able to teach them massage therapy and giving them that tool that they can still connect is pretty awesome.
Wow. What a powerful moment for the family, en masse. Incredible. So, and the billing aspect about it?
Yes, so we are able to bill under the 2 codes, Swedish massage or manual therapy, and it needs to be in 15-minute increments. Mm-hmm. So if I'm in, a room for 17 minutes, it's 1 unit.
Yeah.
So.
Yeah. Wonderful. All right. And just future directions for the program. Any ideas?
Oh, yes.
Somehow I knew the answer would be yes to that. So.
Yes, so we do have, each one of us, we turn into our lead, our annual goals. Mm-hmm. So it's something that we're, feeling passionate about, maybe something that we want to change on our floor, maybe something that we're working toward as a team, which I think is wonderful to do every year. It kind of gives you a fresh look at where do I want to go and where do I want the team to go from here. Mm-hmm. And then program development, boy, has it changed. I mean, Corrie's been here for, how long is it?
19 years.
19, well,
13 for massage.
13 on the massage therapy team. It has changed a lot. I've been here 7, and it's changed a lot just from there. We have definitely expanded onto every unit pretty much, but there are some patients that we could maybe have a little bit more presence with, and that comes with development with on the floor, and then also staff availability. Yes, our team is still growing, and then research definitely has amped up from when I first started 7 years ago. We have 3 to 4 EBP, which is evidence-based practice journal clubs, a year. So 3 to 4 a year, and it's 1 to 2 massage therapists who might have a question about their floor, or how do I better serve this patient population, or I saw something on the floor and I really want to pull research to understand it better. So I help with that development and helping them search for articles on massage therapy and answering their question. And then they put it into a matrix, which is like boiling all the information down. They present it to the team.
Wonderful.
Which is wonderful. So we're all learning about this one specific subject or patient population.
Wow.
We just had one yesterday on torticollis and head preference. Yeah. Which was so much fun because we maybe had an issue finding information from massage therapy, but we were able to pull research and information from physical therapy.
Sure.
And they were doing soft tissue mobilization, which is massage.
Yeah.
So we were able to find articles that answered their questions, also gave us a little bit more of a framework to work in to help create best practice and best results for our patients.
Sure.
And then also with the program expansion, we're looking at doing more posters. You know, we saw Jake's and Corrie's at the research conference, massage therapy research conference, and we're wanting to do more posters, and we're wanting to do hopefully more case studies and research. We're trying. It can take a little bit, and I think that we need to, whether you're looking at someone who's working in the hospital or someone who's working in their own office, don't lose heart, and we need your case reports and your posters. And then also,
I'm going to put you both back on the screen again. Go ahead.
Okay.
Go ahead.
Also, the expansion is also into more units that we can provide care to. And we're also looking out into the community. How can we educate the community a little bit about how massage therapy, how they can learn massage therapy to work on their own children, and also conferences. We had our first conference last year, which was an overview of our program and also talking about research. And we're also looking at, for next year, Jake's results from the grant that he was awarded through the Massage Therapy Foundation, which I think we're in a very unique place for him to be able to gather that information. We're able to get a lot of information from a lot of patients, and that I think is remarkable, and I really look forward to learning what he's finding.
Well, I can say that on behalf of the Massage Therapy Foundation and really the profession at large, we are so proud of you, so amazed at all the great work you're doing for representing the profession so well in such an amazing environment and in such an integrated and collaborative way. So thank you both for the great work you're doing. It's really a pleasure today to shine a light on that. And we look forward to collaborating with you on multiple projects, more posters, maybe some case studies, more research. There are people to be helped, and this work is a wonderful way to do that. Thank you both. Have a great day. Thanks everyone for watching this episode of Research Perch from the Massage Therapy Foundation.
If you enjoyed this podcast, please consider donating to the Massage Therapy Foundation so that we can continue to bring you this and many other resources to increase your knowledge and improve your practice. Thank you.